Women's economic potential represents one of the world's largest emerging opportunities, with the capacity to contribute $12 trillion to global GDP by 2025. By equipping African women with digital skills and fostering entrepreneurship, we're not just unlocking economic growth, we're driving transformative social impact that reshapes communities, nations, and the continent as a whole. Recognizing this opportunity and the persistent barriers, the African Women in Digital Health, or AWiDH initiative, was launched to take concrete action toward building a more inclusive and equitable future. The journey began in March 2022 at a strategic digital health member state meeting in Dakar, organized by Africa CDC. Among all the participants, there was only one woman. This stark reality triggered the urgent need to bridge the gender gap in digital health. Following this meeting, key stakeholders, including Africa CDC, the Ministry of Health and Social Action of Senegal, and Speak Up Africa, came together to lay the groundwork for an ambitious initiative. This marked the beginning of AWiDH, the African Women in Digital Health initiative, with a bold vision to close the digital gender divide by empowering African women to lead in digital health. After its creation in Dakar, AWiDH was officially launched in Kigali in December 2022 during the African Health Tech Summit and the Conference on Public Health in Africa. Co-chaired by Africa CDC and Speak Up Africa, AWiDH aims to bridge the gender digital divide and promote strong female leadership in this field. At the heart of its mission are three strategic pillars that drive these efforts. Capacity strengthening empowers women with the skills and knowledge, including leadership and strategic communication, needed to innovate, influence, and transform the digital health landscape. Fostering an enabling environment ensures inclusive policies, partnerships, and the removal of systemic barriers so women can thrive and lead in digital health. Strategic investments drive programs and solutions that empower women in digital health, fueling innovation and sustainable growth across communities. In February 2023, a working group of 16 organizations was formed to advise on AWiDH's strategy and ensure alignment with Africa CDC's digital transformation goals. A few months later, in August 2023, recognizing the potential impact of AWiDH, the Director General of Africa CDC officially approved it as a flagship initiative, aligning it with Africa CDC's digital transformation strategy. This milestone marked the beginning of a new phase for AWiDH, with strategic partnerships forged with Resolve to Save Lives, GIZ African Union, and Shisu. These collaborations provided critical resources and expertise to advance gender equity in digital health. From Geneva to Kigali, AWiDH has championed women's inclusion in digital health on global and regional stages, influencing policies and driving systemic change. The launch of the mentorship program in July 2024 and the organization of the first AWiDH bootcamp in Mombasa in October 2024 served as a transformative platform for young innovators, equipping them with leadership skills and creating opportunities for networking with mentors and potential partners. Today, AWiDH is more than an initiative. It's a collaborative platform uniting diverse stakeholders to drive transformative change in digital health.